Okay, welcome everybody. Today I am joined by Brian Schmitz. We get a unique privilege today because Brian he owned a practice. He completed a fellowship in physical therapy and then decided he wanted to pursue a career in law enforcement. So although he has his license and everything is currently up to date, he is currently working as a police officer. And what is special about that is he's also doing research into the best way to identify and treat the problems that are associated with being part of that profession. So if you're wondering what we're going to talk about in today's episode, we're going to talk kind of about what police officers experience and how physical therapists and other conservative healthcare providers can do to maybe help better identify problems, and treat them as best we can, because it's a complex world dealing with people that are already so active as opposed to a lot of people who may not be as active. So Brian, I'd just like to welcome you onto the show. I appreciate you coming.
Yeah.
Anything you'd like to say before we kind of get going into what you're researching and just talk about that?
Yeah, first and foremost, Nate, thank you so much for having me. As you mentioned, I practiced outpatient orthopedics for approximately 15 years. I've been board certified in outpatient orthopedics since 2014, did a fellowship in orthopedic manual physical therapy. I love physical therapy, extremely passionate about the field, have been involved on the state and national level for quite some time now, and just love everything about the practice of physical therapy. Identified law enforcement officers as a group of individuals that present with a unique set of circumstances that could really benefit from the lens and perspective through which physical therapists see things. And I think that's an important thing, because as physical therapists, we get to spend so much time with our patients. We get to know them. We get to know maybe some of the psychological stressors that they have in their life. We talk to them about sleep. We talk to them about nutrition to a certain extent. We look at them, how they move, and we kind of have this holistic approach to treatment of musculoskeletal injuries. And I think that's something that especially the law enforcement population needs tremendously, because they have so many small factors that contribute maybe to their overall injury risk. And we just don't know how those factors influence injury risk. And so that's kind of the focus of what I'd like to do in this next phase of my career is, one, help this population, but give outpatient orthopedic physical therapists kind of a better understanding of how do we go about doing that? How do we make meaningful change? How do we identify what are the biggest risk factors that are contributing to someone's injury risk, and how do we change that long term? So thanks again for having me.
Oh, absolutely. So I guess my first question, we'll just kind of piece apart the things that you gave as an overview and see if we can't give the listeners some more to be able to focus on or maybe play with themselves. So you said that there are a number of these kind of small things that impact a police officer's life that may not be common in other patients. So what exactly are some of those things?
Well, I'll tell you, my shifts are quite a bit longer as a police officer than they were as a physical therapist. I think there's an inherent amount of fatigue that goes into that, both mentally and physically. Police officers can go from sitting in a car for several hours or sitting behind a computer documenting, as we're all very familiar with, for several hours, and then go to a very intense bout of physical activity. You can go to something that's very physically demanding. You can go to something that's very emotionally demanding. You can go to something that really makes you think, like, what is the best way to solve this situation? And so I think it's that constant fluctuation between kind of this state of rest and kind of state of, hey, I'm okay, I'm in a safe space, I don't have any active threats, to potentially going out to a very hostile and volatile situation that could ultimately lead to something, such as an intense physical encounter. And so I think it's those fluctuations that we see that are specifically unique to law enforcement. I think shift work inherently presents some interesting factors. Some people are working at night. Some people have altered sleep schedules. I still don't know, is it better best to try and keep a nighttime routine on your days off? Is it better to try and live and function with the rest of your family and the rest of your friends and colleagues on your days off? What's the best way to handle that? When I was in the clinic, you scheduled your appointments, and you always had at least a small time where you could kind of collect your thoughts. You could kind of maybe have a little something to eat. You could kind of have that 10 minutes to yourself in between patients where you could kind of just regroup and collect your thoughts. And honestly, sometimes we don't get that as law enforcement officers. And so it's really important to, kind of take a chance to do that when you can, and then understand that some days that might not be possible due to the call volume and just how your day plays out and what types of situations you encounter. So I think nutrition is huge. I think sleep is huge. I think emotional stress is huge. I think, even small bouts of cumulative trauma, whether that's physical or emotional, is really big. And, those really intense fluctuations of going from kind of steady state to a really intense situation in a very short period of time.
Sure. And that makes sense to me. So as far as nutrition goes, are you finding that, and I know that we're not dietitians, I recognize that, but are you finding that police workers, like police officers, because they are shift workers, do you find that they have pretty, what would I say, kind of irregular eating patterns, or that they commonly are having a hard time getting enough calories for the amount of like work they have to do? Or like, because are they able to eat during their shift? I really don't know how, a shift as a, like, let's say a patrolman, like someone who's in a squad car going around town responding to calls. I don't really know what that looks like as far as if they get breaks for food or anything like that.
Yeah, so those breaks are really dictated by call volume. If you have some downtime, you have an opportunity to get something to eat. We do have access at the station to microwaves and things of that nature. But a lot of individuals are eating in their car. They're packing a lunchbox. They're doing something like that, or maybe to a lesser degree, they're actually eating fast food or eating what options are available to them. And unfortunately, where I'm at, pretty much everything closes fairly early, and so you only have a handful of options. Oftentimes, not the healthiest options, and you're eating pretty quick because you don't know, like, am I going to get another call that requires me to kind of ditch this food and go do what I need to do. So I think that a caloric deficit is certainly probably what I've observed, but I'm interested to actually track that and identify that as we move forward in our research.
Excellent. And I know you brought up sleep. Like, sleep is always a hard one to manage. Like, I don't have a shift job, and I probably get like 6.5 hours regularly, which I know isn't the best for me. And I'm not chasing down bad guys. So I can imagine that that's difficult. And I'm sure that if you are dealing with, like you said, these kind of these cumulative physical and emotional and mental stresses, these people aren't able to just go home and shut off. Like, they're not able to just like go home and get rest. Like, they may try to sleep, but I can only imagine some of the, like you said, there's some intense stuff that law enforcement deals with in our country, and I'm very grateful for that. Do you find that, if a therapist is dealing with or helping out a law enforcement officer, would they be able to, like, how might they go about recognizing if they may need an additional referral to some maybe mental health services, or what would be the best way to go about with that to manage that kind of emotional mental stress side?
Yeah, absolutely. I think first off, we have to acknowledge that it does have a significant impact on someone's ability to manage and or cope with a musculoskeletal injury, whether it's the healing process or predisposition to potentially having an injury. So one, as long as we're acknowledging that, I think it's really hard to determine, to speak in generalities. I think every individual is a little bit different. Some people in law enforcement can be a little bit stubborn. And so we may all know that we need to make some changes.
Yeah.
But what else is going on in their life that prevents them from making those positive changes, right? You come off of a shift, you're working nights, and you have court at 10 o'clock the next morning, right? That's a non-negotiable. You might catch a little bit of sleep. You might decide I'm going to stay up. Things of that nature. You may be able to kind of move your schedule around, get that next night off, or switch shift with someone else. But I think there's a lot of factors that play into that, and it really just comes down to one of the things that I think physical therapists are best at is we're really good at reading people. We're really good at building a relationship and building rapport with people and getting to know them on a personal level, right? What are some of those other factors? Do they have, family obligations? They got to take their kids to school at 8:30, but they get off at 6 in the morning. And so, you've got that 2-hour gap. Then you're trying to catch sleep and get ready for the next shift the next night. So I think just recognizing what it is that we do as physical therapists really well, and that's getting to know people, building relationship and rapport, and then trying to identify what are some of the factors. How can you provide some education, right? There's a lot of information regarding sleep hygiene and things of that nature, right? Maybe, after you go for a shift, maybe it's, a walk with the dog, or maybe it's mindfulness practice. Maybe it's something like that allows you to continue to fulfill your familial obligations or whatever it is you have going on during the day, but also, keeps you from overstimulating your brain, keeping you active, and prevent you from getting the good restful sleep that you need. So, you can give everybody the options. You can give them the advice and the education. What they do with that is kind of up to them, and ultimately will play an important role in their prognosis and how they respond to your plan of care.
Yeah, absolutely. So do you feel that, especially now that you are working as a law enforcement officer, do you feel that it's maybe like an underserved community as far as like education about the importance of nutrition, sleep, and stress management goes?
I do. I think one, everybody's busy, even as practicing clinicians, right? We always tend to put the needs of others before ourselves. And I very much see that in a law enforcement population as well. Maybe the one thing that I think is even more prevalent in a law enforcement population than it is with healthcare providers is kind of that stigma, right? Of, whether it's, hey, I'm banged up and I've got this musculoskeletal injury that I need a little bit of help overcoming, or it's even something like an emotional scar, an emotional trauma that you need some professional help with. I still think, even though we've come a long way, there's still a stigma associated with that. There's still this idea of like, hey, I can't serve my community. Obviously, we know we can't serve our community unless we're at our best as healthcare providers, right? But I think in the law enforcement population, there's this: I don't want to display any weakness. I don't want to show any vulnerability. I don't want to ask for help from other professionals when I'm the one that needs to be there to help others and or help other people solve their problems. So I think everybody recognizes the importance of nutrition, the importance of sleep, the regular physical activity, emotional health and wellness, but how you go about that, and is it professional help? Is it colleagues that you can talk to? What the best way for each individual to address that is probably the more difficult part of that problem.
Sure. Like they always said in PT school, it's like, once you've seen one patient, you've seen one patient.
Yep. 100%. No two patients in the clinic or individuals out in the community are ever going to be the same, and their background, their all of those things that play into their presentation are just as prevalent in this population, and maybe even more so, because there's this hesitancy to talk about it. There's this hesitancy to kind of fully disclose everything that's weighing on them, things of that nature. So I do think it's a tough population to work with. But I think there's tremendous opportunity as physical therapists to kind of promote conservative management, promote this holistic approach to, general health and wellness, whether it's from a musculoskeletal perspective or otherwise.
Yeah. So that brings up a good point, because I find it with either current or retired military, as well as current or retired law enforcement. They'll come in, especially I find a lot with back pain, hip pain, like wearing the belt, kind of, they got a gun on one side. It's not evenly balanced. They, and they're sitting so they can turn to type on their computer. And, you're doing an assessment, and, when you're palpating, when you're pushing on them, when you're having to move, like they will move and they will hurt and they will not tell you they hurt. And when you ask them if it hurts, they'll be like, not compared to other things I do in my life. And, so, do you have any recommendations when dealing with those people that, again, they don't want to show weakness. They come from a background where it's not encouraged, because they feel like they may be a burden when they're supposed to be the helper. Like, how do you go about, like, is it just setting expectations during the interview process where they come in and they're like, hey, I got back pain. And you're like, hey, listen, I need you to tell me when it hurts and what you feel. Or do you think that they need a little more prodding? Like, does that hurt? Are you sure? Like how would you go about in the interview and exam process with people that are kind of trained to kind of not show weakness and push through things in order to protect not only themselves, but other people?
Yeah. I think from a clinical perspective, one of the things that I probably would utilize most is some of the nonverbal cues, because you may not get kind of a verbal answer of, yeah, this is really what bothers me, right? And that's not unique to law enforcement. That's kind of a lot of patients that we see clinically, right? Yeah. So you're looking at maybe it's a facial squirmish, or an aberrant motion where you can tell someone's avoiding loading something, things of that nature. And I think that if you're able to identify that, and you're able to bring attention to it and say, hey, I noticed the way you did that movement. It looked like you were trying to unload this area. You were favoring this area a little bit. Tell me what you felt, right? Once they've recognized that you're tuned in, that you're picking up on those things, and they're not going to be able to hide it, then I feel like it opens that door to be like, oh, you saw that. Okay. Well, I kind of feel like this catch, or this, whatever sensation it is that they're feeling. And that kind of just goes a long way in building that relationship, building that rapport, and kind of having them trust that, hey, this person's really in tune. They're paying attention. They're dialed in. I can open up to them a little bit more, and we can start to move forward in this process, right?
Yeah, no, and that makes a lot of sense. So it seems like, and you're right, it's not just going to be them. There's plenty of people who come in like, I got a high pain tolerance, and they don't inherently want to give up that information of, oh yeah, I do kind of feel some strain on when I do this. I do kind of feel some pain when I do that. So I think that highlights the benefit of, I always hear it in strength and conditioning, like the coach's eye, like being able to kind of pick out these nuances of change in motion. And I think in some ways, for anyone listening out there, they may scream at their speakers when they hear this, but like, I feel that this concept of like skilled, specific manual interventions, real close observation, detail oriented, like assessment and observation of movement, it's almost kind of getting shouldered, because people like, they just need to move. They just need to do stuff. And it's like, no, it's like some people maybe, but we can't, throw the other people who do need those specific interventions that may not have as much current evidence that's being pushed towards supporting them. Like, they still need that to get better, because, and I'm sure we'll get into this as well. Like, people who are, like you said, I sit, I got to chase a guy. I sit, I have to go and I got to do a knock and talk that could potentially turn hostile. Like these people, when they need to be, are very active, very strong, quite fast and deal with a lot of loads that most people wouldn't be able to handle. And so the solution when they come into the clinic of like, your back's just weak, let's work on some deadlifts. Or like, I think your knee just needs to do some squats. Like, that's not going to fly when you start getting into specific populations with needs like law enforcement officers.
Yeah. And I love the fact that you touched on kind of how that pendulum swings back and forth, right? And it goes from one extreme to another where, early in my career, everything was biomechanical, right? And, that there was all these rules to movement and how things moved and everything that really and truly have largely been disproven over time. But now that I'm afraid that pendulum has swung so far that we're kind of losing a little bit of that detail-oriented kind of approach to our physical exams. And as you said, there's not a one-size-fits-all approach for any individual. It really does take someone to listen to what that person wants and what that person needs and what that person is going to be willing to buy into, what they think they need, maybe even to a certain extent, and kind of using all the tools in your toolbox to provide them with the best possible plan of care and the best possible interventions that are going to have meaningful change for them. So,
sure. So, so let's say we get past the evaluation, we're able to kind of pick out, those things that we get some buy-in. They know we are paying attention. They know that it's not just like, hey, I've been sent to PT 3 times in the last 5 years that I've been in law enforcement for back pain. Never gets better. I just tell them it does, or I stop going. And and we get into the kind of issues. Obviously, you have 15 years of experience, but now you're in the field. Are you finding that there are kind of these hot spots where it's like most law enforcement officers will bring this up over the course of time? Like I've alluded to hip and back pain. I've seen that in the law enforcement officers I've worked with. Do you find that there are other conditions like musculoskeletal or neuromusculoskeletal issues that are prominent in this like community?
Yeah, I think probably the biggest motivation for my research is that what I've seen in this population is it's usually one event, one injury that creates a lot of fear, right? It creates this vulnerability, right? And I think once we've had an injury, regardless of the outcome, right? Regardless of how well that presentation either healed or didn't heal, regardless of the circumstances, I think it creates this vulnerability of like, hey, I've got this bad knee, or I've got this back that I just don't fully trust. And I think it's that little bit of fear, that little bit of self-doubt, that little bit of, if I need to do something that is outside of what I normally do or is exceptionally physical demanding for me, can I trust that? Is it going to be an issue? And I think that's probably the most interesting thing I've seen with people is they don't forget, right? They tend to hang on to those injuries for a long time. Like, I've always had this issue with my knee, or I've always had this issue with my shoulder. I've got a bad back, whatever it may be. It's not necessarily condition specific, as much as is once there's been an injury, that's kind of the vulnerability that they're very, very worried about. And so I think that's why, at least in my approach to working with this population, it's, hey, what do we do to best figure out how do we identify how to prevent injury? And I think after 15 years in the clinic, I don't know that I have a good answer of how to do that. So I think if we can prevent someone from having an injury initially, it's going to make their career in law enforcement that much more successful from a health and wellness perspective. And I think that's where, it's easy to say, right? If we prevent injury, they're not going to have problems later on down the road. But I think it's a really hard thing to do. And if you look at the literature on injury prevention programs and things like that, we know that they're beneficial. We maybe don't know why they're beneficial as much, and we really don't have a good way of identifying injury risk if we really look at the literature. So,
Yeah, which I've always found interesting, because I feel like a patient comes into the clinic and they're like, "Oh, I got shoulder pain." In your head, you're like, "I'm going to look at these 4 things." And for a good portion of people, not everyone, but there's going to be some consistent deficits that these people have. But it's interesting that the literature wouldn't say that those 4 deficits are inherent to someone developing a problem. So you're right. I think it's like, if you ask someone that's just on the street, they're like, "Well, what causes shoulder pain?" They'd be like, "Weak rotator cuff, poor scapular stability, limited T-spine mobility, blah, 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 blah." But then it's like, we can't actually validate that on a large scale. So what do you think? So what exactly are you looking at, like, or hoping to research, as far as like what are you looking at to study for injury like prevention? Or is it like is it a screening? Is it like a subjective measure where it's almost like a fear of movement? Like, what are you hoping to look at with your research?
So I think the first question that we have to answer is, what does this population look like? And so the first portion of our research is identifying baseline health characteristics in this population. So we're looking at sleep, we're looking at nutrition, we're looking at impact testing, actually. So
What is that?
looking at baseline concussion testing or neurocognitive testing. We're starting to see some literature that suggests a high percentage of the law enforcement population has had a traumatic brain injury in the past, and many of them have had several. And when we think about, the cumulative effect of many mild traumatic brain injuries and the effect that can have on emotional health, on mental health, things of that nature, it's definitely something that we're looking at. So we're screening for post-concussive syndrome. We're collecting baseline kind of neurocognitive measures on those individuals. We're using some movement assessments. And then, so nutrition, sleep, musculoskeletal movement assessment, neurocognitive testing with impact, and then a baseline cardiovascular screen at this point in time as well. So hopefully we can collect this data across several different agencies, figure out, what are we seeing? Are we seeing that, maybe we assume that sleep is a significant factor, but actually most people are reporting good sleep habits. Maybe we're assuming poor nutritional, and dietary influence, but maybe overall people are eating quite well. And then what we need to do with those baseline health characteristics is track those individuals over the next year to 5 years, right? And see who sustains work-related injury, who misses time from work, and then go back and look at the data and say, is there anything that correlates to that, right? And then in between there's a lot of different things you can do to, maybe ask additional questions, right? Is this test truly testing what we think we're testing, right? Is this test truly representative of diet intake and sleep patterns in this population, right? And then kind of go from there. I think once you've identified things that are correlated with injury risk, you have to determine correlation versus causality, right? And then at that point in time, you can determine, hey, what types of interventions do we need to start performing in order to help prevent injury risk? And then you can look and say, hey, over the last 5 years, these were the injury rates. This was the time missed from work, et cetera, et cetera. And then over the next 3 to 5 years, after you've been implementing those interventions, are you having any meaningful effect? And you hope you are. You hope you're going about it the right way. But maybe it opens up another door. Maybe it opens up additional questions, things of that nature. And then I think that third component that we talked about earlier is, once people have an injury, there's this inherent fear of either that injury getting worse or precluding them from doing the things that they want to do in their career, right? And that's not unique to law enforcement. That's anybody, right? I've hurt my knee. Am I going to be able to play with my grandkids, right? Am I going to be able to do the things that I want to do? And so once we kind of have that injury, right, we're doing everything we can to prevent it, but we know injuries are inevitable. There's going to be a time or a place where, things just happen, and that's the result. But at least then we've got a baseline of where you were at before that injury, and we can use that for return to duty testing, which I think is especially important, right? To make sure that you are functioning at or near your prior level of function when you get back to the road or back to duty, back to sport, whatever it is. And I think that's another thing over the course of my physical therapy career that I think we don't always do the best job at. And I think we're getting better. There's more attention being focused, but kind of bridging that gap between rehab and performance and getting people truly back to their prior level of function.
Agreed. And do you feel so? A couple of things. Is there currently a standard? Like, has any law enforcement division put out like a return to duty like standards that physical therapists could use?
I don't believe so. Not that I'm aware of. If anybody that listens to this or anybody out there, I would love to talk shop and talk ideas and exchange information and things of that nature. But I think what we see more often than not is in return to duty testing and in return to sport testing, for example, it's more condition or body region specific, right? And what we realize is that we don't ever function in isolation, right? You may score really well on a return to sport test for your upper extremity or for your shoulder, but that may or may not be indicative of your ability to perform all of your job related duties, right? I have yet to see, and I'm guilty of this myself as a physical therapist, but my outer carrier and kit is a 26 to 30 pounds, right? I've yet to see a return to duty or return to fitness test that incorporates someone's outer carrier in their duty gear. You know what I mean? And so how do those tests differ under load like that? How do tests differ on, when you're on hour 10 of a 12-hour shift and you're fatigued, things of that nature. So I think there's a lot that could be, a lot of information that could be gathered and maybe used to improve how we determine if someone's ready to go back.
Yeah. And I'm glad you brought this up. I hadn't really thought about it. So when you say that you call the outer carry, is that just their utility belt?
Yeah. So I think most law enforcement agencies are moving away from having everything on their belt because of some of the issues that you referenced in regards to hip and back pain, things of that nature. Much less is worn on my duty belt and much more is kind of distributed across a vest, which contains our ballistic panels and most everything that I carry with me. So yeah, everything's on an outer carrier, which I feel helps distribute that axial load a little bit better. It's not something on your waist. There's not something in the middle of your back when you're sitting in a patrol car, things of that nature. But, the outer carriers and all the tools that we carry on a regular basis, again, for me as an individual, range 26 to 30 pounds. So that's a pretty significant external load.
So about 26 to 30 pounds, including the ballistic panels.
Yep, absolutely. So duty belt, outer carrier, ballistic panels, and all the tools that I would need for duty for a given shift.
Yeah. So I mean, for anyone listening out there, imagine wearing a 30-pound backpack for 12 hours while you're trying to keep everybody safe, including wrestling with people, chasing people. Like, that sounds awful. Like, that is not awful. It sounds like a great profession. Yeah. But I mean, it sounds very, very physically demanding. Like, I don't want to carry 30 pounds around.
Yeah,
like that's a heavy load.
Yep, absolutely. And I think it's a significant improvement. I think 10 years ago we didn't necessarily see that. I think there's some costs associated with that that departments have to assume. There's also appearance. I think it gives maybe a little bit more of a militarized look to law enforcement, when they see people in a vest and things of that nature. But I think from a physical therapy perspective and how we distribute load and how we kind of manage that load, I think it's a huge improvement for law enforcement officers. So, but yeah, just something to consider. in terms of, when we're testing people and we're, getting them back to duty, that's a significant load. I think there's some literature that says anything over 10 pounds significantly changes our movement patterns and things of that nature. And so, in our baseline health characteristics assessment, we're actually having people wear their outer carriers just to see how that influences them. We've done some pilot studies and kind of tested people with and without gear just to look at how it influences our testing. And I definitely think, we practice how we play, we test how we play. We need to kind of be in that duty gear to give us the most accurate representation of what we look like in those situations. So
sure. So if and you may not have an answer for this, if a clinic was wanting to become more specific in treating either law enforcement officers, or maybe someone's listening who works with operators like special forces operators or military personnel. In my head, I'm immediately thinking, if I'm treating these people, especially semi-frequently, I would want some type of weighted vest or weighted belt in the clinic that we could use during activity. Like, maybe that's just my thought, but would you have any recommendations on equipment that maybe a clinic may want to potentially look into?
I would just recommend, because you have people of different statures, different sizes, things like that. I would just have them bring their gear in, de-identify themselves, bring outer carrier, bring their duty belt, download any weapons and things of that nature, and just have them utilize that in the clinic. It's going to be a better fit for them. It's going to be specific to how they move and things of that nature. Everyone has their kits kind of arranged differently, and so load is distributed differently. So yeah, you can absolutely just load them, but you could just have them de-identify and bring their gear in if they're comfortable with it. It just kind of depends on your clinic and how big it is, and how different people may have different concerns about privacy and things of that nature, so they may not want to identify in that capacity. But if they're willing to, I think the best solution to that problem is just have them bring their gear, download some things, and it at least gives you a better estimation of what their job related duties are like.
Yeah, no, and that's an excellent point. And I think that kind of leads me into the last thing I'd like to try to get your thoughts on for a few minutes. I struggle because I have a number of law enforcement officers that I've treated in the last number of months, and it's hard for me to know, because a lot of the trend that I'm seeing, especially with like ICE, like the Institute of Clinical Excellence, is this kind of loading bias where it's like people just need to be more like work hardened. People need to be able to lift heavier things. And I'm not really sure where I sit on that. It's like going to what we talked about, like they're going to sit for a number of hours and then potentially need to do something very vigorous. And there's not a lot of ways to really recreate that over the course of an hour treatment session. And so, like, do you have any specific thoughts now that you are working as an officer? Like, do they really just need to be stronger? Should we just load them up? Or is it that they lack? Sorry, I have a St. Bernard. She's kind of loud. So if you're that's kind of her over there. But like, or is it more like, I know that, again, literature isn't a big fan of this. Is it more stability? Is it more motor control and coordination? Like, what would be your thoughts for someone who may be seeing a first responder or a law enforcement officer for the first time, and they're like, do I just make them exercise? Like, because I'm not really sure I have a good answer.
Yeah. I think if I had that answer,
sure.
I'd be in a lot different position professionally and personally. I probably have my own personal bias as a clinician. So my practice was situated in a 24,000 square foot gym facility.
Nice.
So we were partners in the gym, and then practice PT downstairs in the clinic space. I have a background in Olympic weightlifting. I'm a certified strength and conditioning specialist, so I have a very biased lens towards that. However, I would probably go as far as to say that most of these people are not inherently weak. It's not a work hardening or conditioning problem. For professional law enforcement officers, I think those people understand the risk of not being physically fit. I think that they understand the importance for their own personal safety and the safety of those that they protect and serve. That most individuals take that fairly seriously and or have the physical capacity necessary. Um, I struggle with the idea of stability or motion control
Sure.
because
Sure.
I think it's hard to quantify. I think it's hard to
Agreed.
create buy-in. I think if I can't objectively measure it and or see it consistently, then it's something that's hard for me to create buy-in for with a patient population. So I probably don't go in those things. I think about it from the perspective of, there are going to be people that walk into the clinic that are deconditioned, that need work hardening and need physical conditioning. I think a vast majority of the law enforcement population is pain inhibition, truly. They've had an injury. They're fearful of how that injury impacts their ability to respond to an emergency situation and to, in all honesty, a proverbial fight for their life. And I think it changes how they go about loading things. I think most police officers and law enforcement officers that I know that have kind of observed work through that process are just fearful of not being able to do what they need to do to protect themselves or others. And so I think initially we have to, as much as we hate to say it, we've got to try and get pain levels manageable, right? Sometimes that's by loading, sometimes that's by unloading, sometimes that's by doing something else that is going to help get pain levels manageable, and then determine, hey, in this individual, what is it that they need most, right? Is it a redistribution of load? Is it, more unloading throughout their shift, right? You think about a flexion-based low back presentation and they're sitting in a car for 10 hours a day. How do we get them to unload that lumbar spine, gradually throughout the day, right? Is it, they're taking a walk or they're doing some extension-based movements somehow throughout their day to unload that issue, right? So I think that, again, it's great to see that shift to kind of the fitness forward, kind of everybody needs to load and get stronger. You're 100% speaking to my personal biases. But I don't know that actually applies to most of the people that I've encountered in law enforcement. I think more often than not, they're in the position they're in because they've continued to load and continued to push through something, and they just need permission to take it back, to unload, to help that body structure recover, to address all the other factors that are going on in life, and then to gradually build them back up to where they were previously, right? And I think that's a hard part, as well as like recognizing for this population, it's like more is always better. I need to work harder. I need to do this or that. But giving them permission first and then helping them slowly build back up so that they're not just going to overload and cause issues again moving forward. So it's definitely been a mindset shift for me. But I think it's definitely something that we need to be careful again, that pendulum doesn't swing too far forward in that direction. And that's the only tool that we're utilizing to help people.
Yeah, no,
Speaking about
agreed.
loading.
And I think to your point, like something that needs to be understood, and I would love if someone knows more about this. It's like, how do you determine, do they need more load or do they need Daisy? Shh. It's like, do they need more load or do they need less load? And Daisy, shh. Well, and I think a lot of providers, from either lack of their own experience with strength and conditioning, are unaware when someone really needs to be deloaded versus loaded. And I think sometimes the different mechanics of different positions and how they load the spine and this, that, or the other, they aren't always understood to the level. Like I would have never thought about deloading the spine without taking off that 30-pound vest.
Yeah, absolutely.
And right, because they can't take it off, like they are on duty. And so finding ways to deload in with these positional preferences, just so that their body doesn't take this repeated, positional stress. Like I never would have thought about that.
Yeah.
So I think that's incredibly insightful. Like, do you know when you should unload these people? And do you know the best way to help them unload in ways that would not require them to remove the gear they have to wear?
And I think one of the things is, physical therapists in general, the best physical therapists do the simple things really, really well, right? And so just doing a good job in your subjective exam, determining the severity and irritability of someone's, presentation. And then that can kind of oftentimes help you determine, like, do I initially need to unload, or, can we start loading this individual right away? And oftentimes it's, hey, maybe we're going to load them up initially and we find out it's a little bit too much load. Things get irritable and we've got to unload them a little bit, get that calmed down, and then get right back to that. So I think it's this very dynamic process. I think it's, really doing a great job of understanding what you're seeing each patient visit, and kind of being flexible enough to not say, like, I'm just going to load them up and get them stronger. Because I think while that may work for a vast majority of the population, it's not going to work for everyone. And being nuanced enough to pick up on when can I push, when can I not. Think about someone coming off 4 consecutive shifts. They're tired. They've got paperwork to catch up on. They've got life to catch up on, things of that nature. And then you're just adding load onto all the external stress and things of that nature. Sometimes they need a break. They need permission to say, hey, let's get this calmed down, and then we'll start loading, the appropriate manner moving forward. So, doing the simple things well, recognizing, severity and irritability of a patient's symptoms. That's not specific to law enforcement, but it makes a huge difference in the physical therapy plan of care and how patients progress throughout their plan of care. So,
yeah. So if I were to kind of summarize my thoughts, and then I'll let you finish with anything that you would like. It seems like first things first, really good subjective, particularly like irritability, severity. Talk about, like, be aware that a lot of these people are sitting for extended periods. Like, ask them about maybe these different positions, how they feel in these positions. Know more about maybe in their specific area, how often are they in the car? Like, do they regularly have a large number of calls where they're going to be moving around, where maybe some of these movement strategies while they're up and about are realistic? Or are they, doing patrol where they're going to be sitting driving most of the time? It's like, and once you kind of delineate that through the interview, like when they're moving, you need to watch them. They may need along with other patients who may not want to freely give up what hurts, you may need to pick things out to where you get them being like, oh, this person knows. They are looking, they're watching, they're knowledgeable. Kind of get some of that buy-in, because you may need to tell them they need to do less. And if they don't trust you, or if you can't kind of get to kind of that more vulnerable part of them to let them believe you, you may not make progress if that's what needs to be done. Because it sounds like a big percentage of these people, the biggest thing is going to be pain management at first. Like, get that pain down, because a lot of them, sounds like there's a large number of people who have previous TBIs and other injuries of some kind due to the nature of their work that is leading to some type of underlying hesitancy in, like, if I needed to use this to protect myself or someone else, would I really trust needing to load it the way it may need to? And once you kind of manage that pain, you begin to kind of reintroduce activity to try to regain confidence and kind of load them up, getting to that point. Because to your point, like, they're not inherently weak. they're inherently fit or like strong people. They need to be that way to handle their job, but that doesn't mean that being stronger would not help them take less stress because of their job. I think the other big thing, if I could summarize this, is you need to recognize that physical therapy and being active and their activity levels is only a piece of what is a very varied, mix of sleep schedule, nutrition, mental and emotional stresses that, is seriously going to impact their ability to participate in the physical things we would like them to do in the first place. And I think as far as I'm picking up, that's kind of my overview, as well as maybe key things you brought up is, if you can, have them bring their gear when you get to that loading phase and you're kind of returning to duty. If they're comfortable with it, have them bring their gear, obviously, again, downloaded so that, it may not bring in the firearms, but have them participate in what you want them to do in their gear so that it can be as activity specific as possible.
Yeah, I think that's an excellent summation. I feel bad as you went through that. I don't think that there's anything that's truly specific to the law enforcement population. Sure. In regards to that, but I think it highlights kind of, at least in my own opinion, what I think a good outpatient physical therapy encounter would look like, right? Someone that's, taking a good subjective exam, someone that's doing the simple things very, very well, someone that's establishing rapport and developing a relationship and building trust, and then someone that's actively problem solving to seek solutions that are specific and unique to their patient population, whomever that might be, right? And then certainly, specificity is very, very important, but not kind of devaluing the idea of like even a simple change to their kit and how their load is distributed may have a tremendous impact that they just never thought of, right? I've been wearing that for 20 years in that same way. Obviously there's cumulative stress associated with just simply having that be the same for so long. But then maybe once you've had an injury, giving them, permission to kind of move things around. And that's going to be a hard thing to convince someone who is, drilled in and has built this repetition of, this is where my handcuffs are. This is where, whatever it is that I need is on my body, right? People may be very reluctant to do that. But it's worth creating the suggestion. It's worth bringing attention to, hey, maybe just making this small change might have a tremendous impact on how things feel and how things move for you. But I think at least what we're trying to accomplish is, I don't think as a profession or as a physical therapist, I personally have a good understanding of how do we identify risk, what predisposes someone to injury. And I truly hope that by doing this research, by focusing on a population, by living kind of what we're researching on a day in and day out basis, I hope that we're going to get some additional insight into, maybe it's not specific to just a weak rotator cuff. Maybe sleep is a significant risk factor for any type of musculoskeletal condition. Maybe it's nutrition. Maybe it's, we're studying resiliency a little bit. So we're doing some brief resiliency scales and things of that nature. Maybe it's just a psychological, mindset to injury and some of the fear components that we talked about. But what is it really that parcels out over time as being most indicative? And then how do we address that, right? Because I think there's a lot of things that give us information of things that we can work on. And, how do we create buy-in? How do we make it fit their life and their schedule? And it's again, not unique or specific to law enforcement population. But I think it's what generally good physical therapists do and what I would like to see in a physical therapy encounter now that I'm on the other side. So.
Sure. No, and you highlight a good point that I think is a good one to end on. And it's that the principles are the same. Like being thorough and being detail oriented, knowing what the evidence says and working in creative ways to address the person's need are a given. But I hope for anyone listening, like you picked up on some things we talked about, that there is a lot that goes in to serving in the position that law enforcement officers do to make our communities safe and to help us have better lives. And we really should be aware that it isn't just about one thing or the other when dealing with anyone, but maybe particularly people who are in such high stress jobs regularly for the good of the community. So Brian, I want to thank you, man. I appreciate your time. You mentioned that if there was anyone listening or people interested in the same topics or people working on the same thing, that you would be happy to interact with them or communicate with them, talk shop, and figure out the best way to go about getting this done. For anyone listening, Brian and I are going to chat after the recording's over and figure out the best way to go about that. Given that there are some potential restrictions to communicating with a law enforcement officer, and the best way to go about that in a way that is safe for everyone and make sure there aren't any issues.
No, I would welcome talking to anybody. This is something I'm very passionate about. This is something that I think we can make a ton of change in this population. And for anybody that's been doing it or has some ideas or suggestions about how we can formulate our research moving forward, I would love to talk with you. So thank you again for your time, and appreciate you giving me the opportunity to kind of get some exposure, and hopefully we can better serve our law enforcement officers and kind of better, function as physical therapists moving forward. So thank you.
Yeah, absolutely. So everybody, thanks for listening, and take care.